Thank you. Well, this is a topic that has come to the surface, I'd say probably in the last 10, 15 years, where in human medicine, the physicians are asking veterinarians, how do we help people with aid in dying? And then we're asking physicians, how do we help our animals have a death without the help of euthanasia? So we're kind of crossing over now, and it's very interesting. We can learn from each other. But I was asked to give this talk to the International Association of Pet Hospice and Palliative Care a year or two ago. And, but it was a point-counterpoint. We had a person that had a shelter, a self-proclaimed hospice shelter, that they took in animals and would take care of them until they died, and they liked natural death. And these people are very, very sweet, very nice. So I wanted to make sure I didn't do anything abrasive. We are opinionated. I think most veterinarians do feel that when we help an animal cross over the rainbow bridge, we're serving society, we're reducing a lot of unnecessary pain. But we can be at times critical and judgmental and condescending when there's a difference of opinion. And you were all telling me that your holistic viewpoint is often disparaged by other veterinarians. And so I have to say, if we're all in the understanding mode, we have to look at other opinions and try to see their perspective and see their point of view. Even if we don't agree with them, if we can just try to get in their shoes and see how they feel, it's very helpful. So what I looked at is this death with dignity movement. Most end-of-life people do not want to be latched to a conveyor belt of mindless machinery of medicine. They would tell you that ahead of time. But sadly, so many people wind up in that mindless machinery of medicine because of a situation that they didn't have control over. Often enough, it could be a car accident, it could be a heart attack, it could be an acute attack of something where they just were admitted to a hospital and then they went into that grind. So if they were asked ahead of time, what did they want? They wouldn't want to be in that grind. Death with dignity and aid in dying is expanding, and many physicians are absolutely not in favor of it. They just will not, in their own personal ethics, allow that for their patient. And so if you know of someone who wants to have aid in dying and their doctor is against it, they need to switch doctors, or the doctor needs to refer them to another physician that will help them. But most societies will condone euthanasia for suffering animals, and we look at it as a merciful act, and yet society has had trouble doing that with family members and patients. The MDs, they shun euthanasia where veterinarians have shunned natural death. So it's kind of fun to see that, there's this one medicine crossover going on now. We want to always think about euthanasia as compassionate, and it's an endpoint for animals, but one of the members of our ethics society, she's a PhD ethicist in Colorado, Jessica Pierce, asked us, why do we not give that consideration to our human companions? It's a big question, and she writes for Psychology Today, and you can look up some of her articles, they're very interesting. And this is a veterinarian, Jessica Volsang, who's written in DVM 360. When her mother had cancer and was sick, she wanted to look at how easily it is for veterinarians to control how their patients die versus she couldn't do that for her mother. And she worried that her mother would have no access to death with dignity in her state. And she said the fear of helplessness was a terrible feeling. And she wrote that in a veterinary journal. And so this is, the questions we're asking so far as the human aspect. And why is euthanasia the unchallenged imperative in veterinary medicine? This is still Jessica Pierce. She's looking at everything from all different sides. She says, when medicine struggles, emotional fallout will push to change. Physician aid in dying versus veterinary-assisted natural death is not a dangerous choice. So she's saying a lot of veterinarians could help people with their pets with natural death as long as, it's supervised. And she said the doctors, the veterinarians should not feel that it's dangerous. Okay, and so these are various opinions from ethicists. And she wrote in the New York Times this op-ed, euthanasia is typically thought of as a choice between suffering and death. And indeed, it can offer relief from unyielding pain. But death is too often prescribed as a de facto treatment for suffering when much less aggressive possibilities exist. And I think our whole day has been about that. We can ease our animals into the valley of death rather than abruptly shoving them off the cliff. And that was Jessica Pierce's comment about veterinarians who recommend euthanasia quickly or early or at diagnosis. I met a lot of people in my 45 years of practicing who had a dog diagnosed with osteosarcoma that ran away from their vet who wanted to euthanize the dog because he was diagnosed with osteosarcoma even though he still had months to live. But the diagnosis is what led the doctor to make that next step. I don't think we do that anymore. And I think that some of my writing has been instrumental in helping doctors give people the options of pain management and other procedures. So we just don't want to shove them off the cliff. And yet still that happens a lot in emergency rooms. We were talking about hemangiosarcoma hemoabdomen dogs that they could have the hospice vigil to go home with instead of having an instant euthanasia if the people are not going to put the $3,000 to $5,000 down for an emergency surgery. So we want to help with the possibilities. So I do think that death is too often prescribed in our profession. I think we're getting better, but we're still not there. And I was asked to write in the International Journal of Ethics by a bunch of thanatologists. Do you know what a thanatologist is? It's a person that studies death. The word euthanasia, so thanatologists study death. So a group of them asked me to write actually a whole chapter in this journal that was going to be devoted to death. And I said, oh, you must be mistaken. I'm not a physician, I'm a veterinarian, and blah, blah, blah. And they said, no, we know who you are. And we know that you know a lot about this topic, and we would like to hear from you. So I said, I don't have enough time to do a chapter, but I will give you that other option, which was a 5,000-word expert commentary. So I wrote that up, and it appeared to be the most downloaded article in that journal. Because human physicians want to hear from doctors, veterinarians, because we have thousands in our career of cases that we've helped patients die. And even though we feel it's an emotional burden to do euthanasia and to deal with death, it is still something that is a skill. I have always viewed it as a privilege when it's a patient that I'm helping. And I think that the answer, I thought I would get their attention if I said, are we kinder? Are we kinder to our patient at end of life? And the answer is always yes. And the reason is because we do help them die when they're dying, if dying is difficult. And so I also have this, is hospice kinder than hospice? Hospice is kinder because we treat palliative medicine. The whole day was about that, whereas human hospice does not treat with palliative medicine other than comfort care. That doesn't take care of the comorbidities. You can die from other comorbidities rather than the terminal illness that you are dying from if you don't treat all the diseases, whereas palliative medicine treats everything and embraces the patient with treating the primary disease that's causing the death and all the comorbidities, which may be competing for death, but also are justifiable treatments. So I just wanted them to know that I was a veterinary oncologist and that it was a crossover perspective for euthanasia of terminal patients in human medicine. And so we're often glad that we can be kind. And I'm hoping that we always think about that when it's time to do euthanasia, that it's a kind thing that we're doing for society. And so the expert commentary looks at the fact that society has a dual ethic on the standards for quality of life at the end of life between animals versus man. It is a dual ethic. And we've been living with this for years and years and years, and people are starting to ask all these questions. And the idea of the cherished value of the human-animal bond in society, we have adopted the pediatrician model. That's pretty much when you're taking care of a patient, you are actually acting like a pediatrician. The only thing is, the difference is that the small animal versus a pediatrician, our pets are considered geriatric. You know, quite often at end of life they are geriatric or they have cancer. But there's no difference in treating a pet that's sick than treating a person's child. They have the strong emotion, and we cannot undervalue or underplay or undermine the fact that they feel just as bad as if they had a child. We know it's an animal, and they know it's an animal, but their feelings are so emotionally draining for them that they're feeling like they're losing a child. So the questions around natural death are, is euthanasia suggested too soon and too often by DVMs without sensitivity to the human-animal bond? I say yes, clearly yes. Should we, and how do we, support carers who want natural death versus euthanasia when quality of life is poor? Are we obligated to serve the human-animal bond? Because we're obviously trying to help them keep the bond. That's why they want to go on for the natural death, is they just don't want to make the decision for euthanasia or experience the burden of responsibility for causing that pet to die with our hand. So I've always looked at, do we serve the bond or the pet? We have to look at cultural preferences, and we've got to look at the person, their personal religion, who they are, and what we can do to change about our standard of practice and our attitudes to improve our services to carers who struggle with euthanasia. Many people just cannot, in their heart and soul, give us permission to do euthanasia. They just cannot do it. And I deal with these people, and it does bring us moral stress. There's no doubt. But you know, we know that the physicians avoid the bad news talk, and we know that in humans they've had serious consequences. People have suffered unduly because the doctor wouldn't talk about death. Whereas they can lose good time with their family and reflection and spend more time, unfortunately, in the hospital, and often due to adverse events from having the can-do medicine. Instead of facing that death is coming and that they could go into hospice or palliative medicine, where they can get counseling. So the avoidance of the bad news talk is now considered neglect in human medicine, especially in New York when they made that law that the doctor has to advise terminal patients about death. You have a question?
That pretty much was it. I mean, there's a law that a doctor can't just do it without permission from something.
The physician?
Yeah, the physician.
That
Like
they
he feels it's not just up to him to terminate a life. That has to be.
Oh, it has to be an ethics board.
Yeah.
Oh, yeah, yeah. For people with aid in dying, they have to have an ethics board, and they have to qualify for having a terminal diagnosis. And, you know, pardon me? Pardon?
Was that recent, the law in New York?
In New York was 2011 when they actually litigated that physicians need to tell people when they're terminal. Now, in Japan, they never do that. The Asian culture does not want to cause the patient unhappiness and stress, or they call it a bad face. And so that information is withheld from the patient. The family may know, but the patient is going on, you know, not knowing. And that's a different culture. And when we have Asian families, I find often enough, they're feeling very similarly for their pet. So there was a debate that was on the NPR, should physician-assisted suicide be legal? And this was in 2014. And back and forth and back and forth. Oregon legalized physician-assisted suicide in 1997. And only 700 people took advantage of it for many years until November 2014. So it's not that people are rushing to do this, they just want to have the choice. They want to have the confidence, like Dr. Volsang. She just wanted the peace of mind that her mother could decide on her own if her life was crumbling. So advocates of assisted suicide laws believe that mentally competent people who are suffering and have no chance of long-term survival should have the right to die if and when they choose. And people, if people have the right to refuse life-saving treatments, which they do, that's the advance directive, they argue they should also have the freedom to choose to end their own lives. So these are the wordsmithing from the lawyers who are arguing about it back and forth. And we look further into the debate. Opponents, the people who do not want to do aid in dying, feel that these laws would devalue human life. And they feel that medical prognoses are often inaccurate. And we talked about that. One doctor I met today said, I don't like to give a prognosis. And I will, people need to have the reality buttons on. And you can outlive a prognosis, but I think people should know if their pet has a terminal disease and what the expected lifespan is. And if we outlive that lifespan, hooray, we celebrate. But the arguing the fact that your prognosis may not be true for you is, to me, not enough of an argument. Some people who have been told that they will soon die live longer. Well, that always happens. There's always that bell curve. There's always somebody that's way out there, and we don't know why. It could be just sheer determination, and one doctor was impressed with the fact that I had mentioned about the one dog in Mammoth. He was having too much fun to die because he got to go to Lake Mary twice a day instead of once a week with his abdominal masses. So the argument against it is that seriously ill people often suffer from undiagnosed depression or other mental illness that can impair their ability to make an informed decision. Well, seriously ill people are probably depressed. And whether it's diagnosed or not, I don't know if that's a big argument. I personally don't think that's enough of an argument. And so if they want to put the person on antidepressants and then they change their mind about wanting to die, that's fine. But I don't think you have to have a big workup I think that end-of-life patients should all go on antidepressants if the doctor thinks that they're feeling negative or thinking negative or that they want to die. But that's just my opinion. So overall, we look at the pro-aid in dying option, and we have some very brilliant thinkers. Peter Singer from Princeton, Andrew Solomon from Michigan. These are people who are thought about as global thought leaders, and they rank among the world's most influential people, were asked to speak. And they argue that policies legalizing physician-assisted suicide are unethical, and others would say it is ethical. So there's people on different sides. The human dilemma is that people who are longing for euthanasia, especially if their disease is fulminated, when the body is in relentless decline, and yet they're being kept in suspension to scientifically deny death. Okay, we can suspend life, and the life can often be not worth living. And that is our problem. It's a new problem because science has just gotten so sophisticated. So this is accomplished very well in modern medicine, and we can do that in veterinary medicine as well. So people want and they need advance directives more than ever. If you have parents or aunts and uncles, it's really a good idea to get everybody prepared. There's a new thing called deathing parties. Have you heard about them? Yeah, you invite your friends, serve them a nice big meal, and say, what happens if you're gone tonight? Is everything ready? Is your will ready? Is your advance directive ready? And this really helps people get together and figure out what they want to do. The Right to Die movement has been discussed big time since Dr. Jack Kevorkian became very famous when he was the American face for that movement. And he was a Michigan pathologist who not only pushed for the right to die legislation, he also helped several patients die and wound up in jail for that. But he had one case that led to that conviction in 1999 from a patient who suffered from that horrible disease, amyotrophic lateral sclerosis, ALS, commonly called Lou Gehrig's disease. And ALS patients, we've read Tuesdays with Maury and other books. It's good to read as much as you can about dying. I mentioned Atul Gawande's book. What was the title of that book? What it?
Being Mortal.
Yeah. Okay. Very good book. I read it twice. Wonderful. So the big question, can we help veterinarians, is can we veterinarians help MDs, and can MDs help us? This two-way exchange. We walk away from a euthanasia knowing that we perform an act of mercy for our patients and their families. The physician has trouble talking about death and doubt and fear, and they don't want that patient to die on their shift. I think a lot of them are afraid of litigation as well. Veterinarians certainly face that more often. We also face Yelp and criticism online. But we have overall a wonderful contribution to helping MDs cope with the concept of providing aid in dying for their patients. And I think if you have any MD friends, you can sit and talk with them a little bit about it. And I think that they often, it's not ethics. It's not an ethics violation. It's just not done enough. But there's more and more hospice associations or groups that will give patients they call the terminal sedation, sedate the patient with enough medication that they do eventually pass. It just takes a long time. California joined Oregon, Washington, Montana, Arizona, Vermont on October of 2014 by approving the Right to Die action. And since then, Hawaii, Washington, D.C. have complied. And then Quebec went with aid in dying, and now all of Canada. their Supreme Court decided for the whole country that people have the right to die with dignity when they're terminal. And so we're trying to doctors were raised to defeat death. Not on my shift. The science ideology that death can and should be defeated no matter what the cost, is standard of practice for a large majority of physicians. That's still true. So we're dealing with that philosophy when we have the MDs avoid helping people die with dignity. I think a lot of veterinarians have the philosophy too, that they want to defeat death, but we are so close to it because our patients become geriatric and terminal within a decade that we are more comfortable with death. The unique thinking that we've just described is very American and encouraged by the innovative for-profit medical marketplace, which has not yet defeated the inevitability of death. So we need to talk to people about the cycle of life, the fact that we're all dying, and that being afraid of death. I mean, we're afraid of wrinkles. That's the problem with this country. We are afraid of wrinkles. And people are having plastic surgery to look younger, and they're doing all kinds of things. And what are they doing? They're exhibiting the fear of natural aging and death. Physicians have gotten detached from death. They feel it's unsustainable to continue practicing if they're looking at death, and the stress on them. And we do it every day. So they're asking us, how do you negotiate it? Because we see death so much more often than physicians do, even human oncologists. So the thing is that thinking about the healthcare system, look at how many people are turning every day, another year, and we're going to have our rest homes filled with vegetation, human vegetation, if we don't figure this out soon, because the baby boomers are going to be here demanding the right to die because they don't want to be in a rest home vegetative. Question?
Just a comment, your use of the term rest home.
Say again?
Your use of the term rest home, even in our language, we avoid any reference to reality. We're not resting there.
I've never even thought about that. Thank you so much, because we're so accustomed to rest home, the rest room. I have people tell me, my clients come in and tell me, he went to the restroom, it was liquid. What? Huh? So we have these misnomers that we've adopted and accepted. And you're the first person, I call it, warehousing vegetation. But the fact is that these rest homes, quote unquote, so many people there have no clue of what's going on. Their body is there, their mind is not. Their relatives gave up going to visit because they're not even acknowledged. So we have a situation that's a burden on the healthcare system, big burden. And I'm not afraid to talk about it, and I think that as veterinarians, we could even tell clients, what if we didn't euthanize our animals and we just collected them, or put them in some facility, that would be an ugly place. Okay, so anyway, the talk about fetal medicine versus palliative medicine. This is a very interesting study. A survey of terminal cancer patients who elected salvage chemotherapy for recurrent disease found that a majority of the patients were under the unsubstantiated impression that chemotherapy would potentially cure them. And this is what the sales job is. We talk about selling medicine, and I think that many people have been sold another treatment option on a basis that gives them some hope, and they're not seeing the reality. Or maybe the doctor didn't say, well, we've only had a 3% or 10% rate of cure. But there's something going on with what the person's impression is versus what the doctor told them. Or maybe what their family told them. But it's well known that many patients in this situation endure chemotherapy-related adverse events that compromises their quality of life or even causes them to die badly in the ICU, like leukopenia. You know, we have that problem, you know, in every chemotherapy patient, but that's a tough one. A survey of lung cancer patients who chose palliative care versus standard care. I love this study. Standard care meaning more chemotherapy, even though they didn't think it was going to work, found that the palliative care group lived 3 months longer and enjoyed a higher quality of life. And these people were counseled about death. Their family members were counseled. They knew that they were terminal, and they had palliative medicine. A few of them did choose chemo because they weren't excluded, but they were actually entered palliative care, which I told you is not hospice. It's the new branch of medicine that was formed after the insurance companies ruined hospice by not allowing people to treat palliatively the primary disease and comorbidities. So in addition, the patients and their family members were more satisfied than those who chose standard care. And this author, Temmel, just did a brilliant job with that study. So you ask physicians what they want for themselves. And I've studied and worked with physicians at UCLA almost all my life. And one of them was a head of nuclear medicine at UCLA. And he told me what he wanted. But it's not different than what's up here. Physicians wistfully express their desire for humane euthanasia for themselves if their own quality of life declines to a worthless state, or if it will help them avoid a slow, painful, frustrating death. They want that. A large percentage of society readily convey similar desires for a peaceful and painless death over the dreaded fate of being caught up in the gears of the mindless machinery of medicine. So most people want this. Pet owners often wish that they could have the same peaceful passing given to their pet. Has anyone ever asked you, Doc, when it's my time, can you help me? Yes. I have been asked that hundreds of times. And we know how to do it. So it's very important that we get that into the law and so that we can help people. They admire the sweetness of their pet's death, and they would like that for themselves. So if natural death is wanted by carers, they need to see us. So often, these self-proclaimed pet hospice groups are struggling for money, and they don't have a good staff veterinarian. And so the one I was dealing with had lots of money, and they had the philosophy of natural death. And this was Gail Pope. I'm not sure if you've ever heard of her group, but she's worked with a lot of celebrities, has lots of funding, lots of fundraisers. And I wanted to respect the debate that we had by honoring the wish for a sweet death, because that's pretty much what they want. And the confusion at end of life, that we have for human medicine and animal medicine is that either or medicine pushes euthanasia too soon many times, or they do the overtreatment that we had a whole lecture on. Who was here for overtreatment? Yeah. So, we've got this, it's not balanced. So we are reluctant to euthanize early at diagnosis, but people are not offered a third option, which is the hospice vigil, especially if it's a terminal patient, or the opportunity to go into hospice-pospice. Some DVMs don't want to do euthanasia when they really should do it, okay? And some carers avoid euthanasia because they feel like they're playing God. And that's tough. you can see that I do see a lot of golden retrievers. 1 in 5 will get hemangiosarcoma, and 1 in 8 gets lymphoma. And the other ones get sarcomas and everything else you can think of, mast cells, whatever. But I always talk about people, talk about the end, because it's really important. When they are diagnosed with cancer, I say, you're going into our hospice program because this is probably the disease that's going to cause the death of your dog or your cat. And so I want to make sure you understand that. And so we go onward, even though if they're perfectly well. But this is a letter from a RVT, a technician, named, I have her name, it's in there somewhere, Kathy Paris. She wrote a letter to, I think it was Vet Practice News, and it titled it, "We Can Do Better." And she said her sister, or her daughter, had 3 hours away from her. So she had to go to a emergency clinic or a veterinary office to request and beg for Joey's euthanasia because she was been treating her for a chronic disease. But the doctor didn't want to do the euthanasia. Instead, the doctor wanted to do the workup, the standard workup we were talking about, that emergency clinics and doctors want to do if it's a first-time patient, and suggested x-rays and, Lasix, oxygen, arthritis treatment. And at the time, Joey was dying, and the person knew it, but the doctor didn't see that or understand or communicate or somehow relate to that person. And so Joey actually died in her arms, and the technician, who's the mother, that's like losing a grandchild and having your daughter, have their child die in their arms. So she wrote this letter, and she said, we can do better, and we can be honest, and we can just do the euthanasia when someone knows that their pet has a terminal disease and they're bringing them in for euthanasia. Now, there's a lot of cases where they just didn't have good pain control, but there are cases where doctors just avoid doing euthanasia. And I'm going to tell you about Debbie Heller. This is, her husband was the best man at my wedding 37 years ago. But Sasha was a 16-year-old kitty cat that she'd been giving chronic fluids for kidney disease. And Sasha was ready to die. And the doctor that she went to passed away on his own. He had lymphoma. He was a very close friend. And the new doctor saw Sasha and said, oh, let me do her IVs. Let's do this blood test. Let's do that. And Debbie wanted to do euthanasia because she knew it was time. So she gets a phone call. The doctor actually had her keep the cat, kept the kitty. And when she was in the parking lot, the receptionist ran out in the parking lot and comforted Debbie. And she said, this doctor doesn't get it. The doctor that passed away knew what to do. But she said, this doctor doesn't get it. I'm sorry. And so Debbie gets a call the next day. The kitty cat died in the hospital. And she was very upset that she wasn't with her when she died. And when she got the $600 bill, she was even more angry. So these are scenarios that are real, and I think you've all run across them. So natural death is something that is really, in my personal opinion, not very natural. Even humans dying now in that rest home, that's not natural anymore because we have already protected them from the elements. We've been sustaining people on artificial techniques, and the animal is being sheltered from the nature's elements, from predation. A frail animal is going to separate themselves from the pack. They're vulnerable. Even the babies, we know that. The frail, and they're going to be eaten and join the food cycle, or the elements will get them. They'll freeze to death, or they'll dehydrate in the sun. So that, to me, is Mother Nature's quick hand. So that is natural. But people have misnamed the misnomer of natural death, meaning that they're not going to have you help that pet die, even though they're protecting that animal from Mother Nature, which is unnatural. So I defy that term, natural death. I don't agree with it. I don't know if you can come up with a term. I haven't come up with another one. But veterinary oversight in hospice for end-of-life patients is a must, because these animals have discomfort, especially if they go into active dying. We owe it to them. I was hoping my voice would hold out. So I think ethically, if you have a client that has an animal that they request natural death for, and I don't have a good name for that, it just means they don't want you to do euthanasia, you need to make sure that pet is not suffering, that they give it enough sedation that the pet will have a peaceful and painless passing. People are always asking me for the fatal drug for their pet. We can't do that. We cannot do that, but we can give them pain medication, and you can tell them to give them more of it so that the pet is sleeping and that maybe they'll pass quietly and comfortably. That's all we can do. It's our obligation.
How about unassisted death?
A question?
How about unassisted death?
Other?
Unassisted death.
Would that be a term?
Oh yeah, but people don't understand what that is. Unassisted death. Yeah. I've thought about that term. Do you think that's what we should turn it? That's what we should call
Are
it?
you assisting it if you're giving them a whole bunch of, codeine or something?
Yeah.
Oh, well, not for that one. So the human medicine calls that MAID, right? Medically assist.
Yeah, aid in dying or assisted death, yeah, in humans. The advantages of natural death are, the number one advantage is that they get to die in a natural environment. What's natural? It's their home. I would say the word natural should be familiar. Okay, I would change that. This is from a text it's now online, called Pet Helpful, promoting natural death. So it's really not natural, but what they really want to do is have the pet not have to go to the vet hospital, that he gets to stay home. Well, we've cured that now with house call euthanasia. So now what's the argument? That's what I ask. So cats, they say they hate to be taken out of the house, and owners can create an area, they're just showing you how to make the cat feel good while they're dying. And that they say the pet is spared from the stress of seeing the vet or going to a dreaded car ride. Well, here's where fear-free comes in. If you've accustomed your cat to the carrier and they like to go to the vet hospital, that's wonderful. But also, house call euthanasia cures that problem. And if the owner doesn't have to wonder if they made the wrong decision by putting them to sleep too early, well, that's the responsibility of the owner. We have to validate, as a profession, as veterinarians, we have to validate that they're making the right choice. And I always say that to them. You're making the right choice for Bella. She really needs your help. She needs your wisdom. And I always ask people to look at the disadvantages of natural death. And the disadvantages are when your pet suddenly starts suffering, you can't control that. You may not have a house call doctor handy, and so the death could be really bad. And then dying is not pretty. Many times they'll twitch, they'll defecate, vocalize, and people tell me it was a horrible experience. I was writing for the Latham newsletter. It's a beautiful one about the human-animal bond, and the editor had a natural death at their house because they were encouraged to, and they hated it. They were so upset, so they wanted me to write about euthanasia. The other disadvantage is that when the animal passes without medical intervention, the process of dying may take hours, days, and sometimes the owners see labored breathing, that Shane Stokes breathing. They see the anxiety, they can see seizures, and many find this very hard to watch, but they're unprepared because they don't have a doctor right there. And this is a sad case that came in, belonged to a family that was culturally unable to do euthanasia. So all we could do was try to relieve infection and relieve pain, but the person could not condone it. And it always causes moral stress. And that's what I tell people. you know, taking, you know, this patient out this far, when I see this much suffering, causes me moral stress and an ethical challenge. And if your client knows that you are stressed out because of the pet's condition, and you are advocating, they often will start to rethink their thought about natural death, especially if you tell them it's not natural, because they've protected the pet. So we see cachexia, we see, well, here's a case, and she has given permission. She posted 85 pictures of her dog's death on Facebook, which I always tell people don't do that. But this dog had big problems, and she did not want to do euthanasia for Roxy. So poor Roxy sat around and started to decline, and it took 2 weeks, finally, when she was actually dying, and many text messages, I mean, constantly text messages to me, but when baby finally died, she said she crossed the Rainbow Bridge on her own. Not very pretty, and it took 10 days for her to die. Now, I don't know if you know who Kathy Cooney is, but she is a big, officer for the Hospice Association, and she said that it shouldn't be more than 2 days for, a pet to be in the dying stage, and anything longer is just too difficult to justify. And I think that we all need to look at that. As if Kathy Cooney thinks 2 days is too long, we should help our clients know that they should be calling us if it's not helping. So wishful thinking is they want their pet to die in sleep. We all want that. I would like that for my death. The ideal situation is rare. The slow decline of a pet may last a long time. It's not Mother Nature's way. Mother Nature is much faster. Many carers cannot properly care for a terminal pet's needs to sustain quality of life. They just can't. And many painful and stressful end-of-life conditions are not recognized by carers despite good intentions. And I really think that Roxy suffered more than she should have because her mama gave her those 10 days to die. It's a sad fact, and it allows more suffering. We talked about the more bad days than good days. Animals have this horrible frustration when just bad, bad, bad. You have a question?
I guess I just want to say this, I don't know if it really fits, but there's been so many lovely movies lately about
Oh, yeah.
dogs.
The
and
Art of Racing in the Rain.
coming back and being, pets, people knowing that their dogs came back or a cat.
Oh, coming back, you mean after they're dead. Yeah, I've been asked to write a book on that, and I said, I love the idea, and I've actually witnessed it, but it's just a little out of the range for me, but I'd like an expert to do that, and it has been done. But, I think we all know the advantages of euthanasia, and I've been told I'm running out of time. So we can do that, and we can do it at home now. And people have this guide for themselves called 5 Wishes, the 5 Wishes. And it's what people want to do for their own advance directives. And if we take this and extrapolate it to animals, they want euthanasia. And then, remember I told you about animal communicators? Well, this particular one has a PhD. She used to work for me as a tech. And my time is up, and I know this is the last talk, so we could talk a little longer. But she did a big questionnaire about animals, and they said that when they became domesticated, they gave up the choice to go under that bush and die. And they've turned over that responsibility to their owners. And I try to tell the owner that they are the good shepherd, to take that role as the good shepherd, to be responsible to help that pet figuratively go under the bush with us, and that the veterinarian can be Mother Nature's helping hand. I think too many veterinarians go home sad and depressed because of euthanasia, but if you look at the fact that you are Mother Nature's helping hand, I looked at whether you're a priestess or a minister or a rabbi, but if we take that role as a privilege, then I think we're going to have fewer suicides in our profession. So help your friends, because not one more vet, when I read about it, a lot of doctors are grieving over euthanasias that were perfectly compassionate euthanasias, but they came home with this burden that was just ready to push them over because it was like the 3rd one that week. Question?
There's
doulas, we're escorting that being across the veil, whether it's birthing,
We're escorting
inside,
them.
or out of life.
Yeah, I love that concept that we're escorting them. Yeah, we're pushing the juice. It's true. And I have to tell you, I hardly ever do IVs. I don't know about you for euthanasia, but just give up giving an IV because that's too stressful. We sedate them. I had a whole part of this talk. I was hoping we could go into it. Who can stay a little longer? Okay. So Stephanie found that the animal will stick around and be loyal to their owner to teach them a lesson, and that they're hoping that the owner will never want a natural death for another pet. That's what they're hoping. And it's real interesting. She said that pets may choose to suffer to teach the carer about death. They want their carers to realize that they're suffering and become unselfish, because the natural death is sort of it's like I want to keep them because I don't want to make the decision, because I'm selfish. I'm afraid to be the decider. And that hopefully they'll never allow that to happen again. If anybody has to go ahead. So I've written an article called Rethinking Euthanasia. It appeared in Vet Practice News a year ago, August, and I've had so many compliments because we're telling the doctor, I didn't have Mother Nature. A group of doctors gave me that idea because being a priestess or a minister is too religious in a secular society. But Mother Nature is out there. And the Good Shepherd, he's a little bit biblical too, but everybody that raises sheep and cattle and goats, they have shepherds in their society. So if we can tell the owner that their role is the Good Shepherd to make that decision, and if we as veterinarians take the role as Mother Nature's helping hand, I think euthanasia angst and grief would be reduced on both sides because they're dying anyway. We're just witnesses. Okay, we are witness to this. And I think that we can alleviate a lot of pain and suffering in our profession and hopefully reduce suicide. I helped put this together. There's euthanasia right there for all the problems that veterinarians have, but sometimes this becomes a huge problem. And veterinarians need to have bubbles, balloons to lift them up, and they view euthanasia as a sinker. And I'm the one that termed the sinker because I'm a fisher. I love to fish, and we use sinkers. And so we're all trying to stay above water. And I think that it's important to know that the veterinary team cannot provide pets and pet owners with the best possible health care if they are mentally, spiritually, physically, and emotionally depleted. So we've got to have thoughts that are positive and creative, and never use the word kill or playing God. What we're doing is we're helping Mother Nature. Okay, so most doctors think that they're doing euthanasia because of terminal disease or money concerns, but the real reasons are pain, organ failure, cancer, trauma, and money comes in later. And there's a survey that in 2012 people would spend $1,700, and then after the recession, or actually recently, people have lowered that because their money's tougher. People's wages are not going up as much. So I think we can end here, but euthanasias are going up, and I think it's because people are making the choice. Animals are older, and the number has increased by about 20%, according to some surveys. And I am always happy when a pet passes away peacefully at home, especially if the veterinarian has provided pain medication and the client is able to give it. And of course we tell people to dissolve it and put it in the mouth and whatever they can, even if they can't take pills orally anymore. And use the quality of life scale. We talked about that in the first lecture to make the decision, and then knowing that breathing is the most difficult and painful thing. If patients cannot breathe and they cannot find a way to help them, then euthanasia is the best option. Okay, I have a lot more slides. This is thoracocentesis. This dog, look at that face. That is a painful face. But this dog came in for lymphoma, but was suffering from untreated osteoarthritis. And so when we treated the lymphoma and the arthritis, that horrible, worried look went away. This dog was walking plantigrade, and we alleviated the pain. We do euthanasia for age-related organ failure, including cognitive syndrome and cachexia. Again, more cachexia. I had more slides than I thought. Obesity, hugeness. Murphy, that we talked about, Robin Downing, her dog was so big, 150 pounds, that she said not being able to walk was a big factor. And when Murphy could not walk, if Murphy could not walk, she was going to do euthanasia. And of course, some people can put him in harnesses. This is degenerative myelopathy. The worst case I ever saw, the most advanced case, couldn't even lift the head, and the family member could not do euthanasia. It was tough. This is a picture of one of the rescue people I told you about. She has 25 of these old rotten dogs, but I thought it was really interesting. 80% had dental disease. She gets them out of the shelter, and they don't have any mandible hardly, or it's just so infected when they clean the teeth that the mandible is gone, so their tongues all hang out. 50% had collapsing trachea, 40% had heart disease and other end-of-life issues, and only 15% had cancer. So it's interesting. This one had a brain tumor. I forget what these other two had, but they're amazing. And these are reasons, cats, when they have tongue cancer, nausea. This dog has cutaneous lymphoma in the mucocutaneous area, and this is malignant melanoma. And so lots and lots of reasons. And some people will keep a cat longer than you ever imagine. This kitty cat belonged to a man, and he was very much in love with this cat. And my job here was to make sure this cat wasn't suffering and had enough fluids. And somehow he was able to give permission for a feeding tube. He could not give permission for euthanasia. So we do all we can to support and go. Tongue cancer, oral cancer, mammary gland cancer, inflammatory breast cancer, terminal, really a bad disease. There it is again. In cats, mammary cancer is really aggressive, and if they're over 3 centimeters, they have a very poor prognosis. We've been trying to beat that, but osteosarcoma, very painful, and so having these animals die a natural death to me is just not just. I think it's unfair to the animal, and I can tell people that, with sincerity, and you have to do it kindly. But that whole thing about decision making I told you earlier is that there is no perfect choice, and for some people, we just have to go along with them and just make sure that the animal doesn't have the pain. And we're hopefully going to give them a quality death. And this is another whole section about bond-centered euthanasia, and I really believe that veterinarians can remove the IV catheter, tussle at the end of life by sedating the patient first. This is a home visit, and giving the patient a really kind and gentle death with a huge, heavy sedation, and flowers and all kinds of things. For bond-centered euthanasia, and I give the final injection either intracardiac into an organ like a kidney or a liver, intraperitoneally if you're can't find an organ, and that would be after the heavy sedation. And I've read on Not One More Vet, which is Not One More Euthanasia, please, or self-euthanasia, Not One More Suicide. Doctors who screw up the catheter are mortified when it's euthanasia. And I keep saying, give up the catheter. Don't put a catheter in, just give it up and sedate the patient in the presence. Never remove the patient from the owner at the end of life. In the last 5 minutes the pet has to live, why take it away to put an IV catheter? That just breaks that whole bond apart.
What do you tell
So,
people before you give it?
huh?
What do you tell people before you give an intracardiac injection?
I have a blanket. I put a blanket over the chest. I asked them to go up to the head, and I said, I'm going to give him an injection. And I said, this one is going to, cause him to pass away very quickly. This is going into his heart, and he won't feel it. And always make sure you tell them that they don't feel anything. And if you miss the heart, just go to the liver. I use these big, long spinal needles now, and they're really great. And let kids be there. Let people have comfortable blankets and pillows if it's in your clinic. Let people call their relatives and friends if they need to, give them time. It always helps to have family members. And if you have to have a catheter, make sure the patient is sedated in the presence of the client, and to put the catheter in the presence of the client. The pet's already sedated, so they don't feel it. But it's really important not to separate them. Question?
What are you using IM that doesn't sting? And
Oh, I give
That's
dexdomitor,
yeah.
big heavy dose, and butorphanol. And I often will give the butorphanol ahead of time so they don't have any vomiting. But dexdomitor, and I even tell them, look, this is reversible in case you change your mind. And they don't change their mind. And Kathy Cooney says that the people that she starts out with death, natural death wanters, that 90% of them will turn around and say, please come and help put him to sleep, because she's coached them. So once again, don't turn them down, but just coach them about what a good quality death should be. And give plenty of time for people to have their wake. I read poetry. We give flowers, the paw print, take pictures. I take pictures and send them to people on their text message. After the patient's deceased, I confirm death, by listening for the heartbeat. I put a time. People prefer that you have that respectful moment. And we have to create a special time. We're the mortician. We wear a lot of hats. Not only are we we used to think ourselves as executioner. Now you're Mother Nature's helping hand, and you're the mortician. Question?
Yeah, mostly you're trying to convince them it's a very humane thing, because you can't really take away
Right.
that pain when they're getting ready to transition.
Right. Exactly. Yeah, and I love it when people have a party, a farewell. I mean, I don't call it a party; it's a wake. But I say the pit is holding court, and the house call doctor should not be afraid to come to a group, and they will not have a horrible experience if they don't do the catheter, because trying to put a catheter in front of a bunch of people is not going to be any fun. Question?
How long should it take if you give it into the liver?
Oh, about 10 minutes, sometimes 5.
Okay.
IP is the longest. A lot of house call doctors just do it IP because everybody's home, they've got the time, could be 20 minutes.
Okay.
Yeah.
My dog, I had euthanized in my house, and it was done by, it was supposed to be a hospice vet, but it was the nurse that came to do it because it was so last minute.
Uh-huh.
The nurse, and she said she was giving it in the liver, but it took like 45 minutes.
45. Then
Yeah.
your pet had very slow circulation and might have given it to the stomach.
Oh, okay.
Your question back there?
As a house call vet, I really have everyone here begging me, do not stress that animal, putting in an IV catheter.
Amen.
Do not make
Amen.
the animal scream right before.
Why do doctors still want to put an IV catheter in for euthanasia? I have no idea. It's in my book. I have a whole chapter on this. And then do all euthanasias go smoothly? No. And if they don't go well, this kitty cat vomited. And the man came all the way up from San Diego for me to do this. So I profusely apologized, and I'm also reminding you, never put a catheter in, and just apologize and give extra attention, empathy. I always either text or email the client a day or two later. I say, how is your heart and soul doing? Because that's when they're really missing that pet. And even though we send the cards, donations, all that stuff, it's very important. And I'd like you to see this quote. I have from Sir Walter Scott. I've sometimes thought of the final cause of dogs or pets having such short lives. I'm quite satisfied it is in compassion to the human race. For if we suffer so much in loving a pet after an acquaintance of 10 or 12 years, what would it be if it were double that time? And so people are always crying because their pet doesn't live long enough. And I said, well, if you live twice as long, we'd be in more trouble. And the afterlife care is very important. Know what you're recommending, because in my book, I quote someone that followed their pet and found their pet dumped in a plastic bag in a warehouse. And it was very tough. So definitely know what you're doing. And this was a totally accidental picture. A girlfriend of mine had this mural at her house, and she liked people taking pictures. I was walking my dog, and I did this, and this, after I saw it, I said, oh my gosh, this is a really great picture. And it reminds me so much that these little guys are spiritual. They have huge reach in our lives, and that when they leave, they never leave our heart, they never leave our memory. So thank you for staying late, and I want you to join the Association for, the American Association for Animal Hospice and Palliative Care. Okay, and they're having their meeting in Chicago, October the 3rd. And it's a great group, and they understand this thing about intracardiac, intra-organ, because Kathy Cooney has a whole class that she teaches all the time about how to bypass that catheter experience, okay? So there's a bunch of references and resources, and great. Okay, thank you. There's a couple of books, too. We did it.
Good job. Oh.
If you have questions, just come on up.
Here are like a couple really.
Finding your visibility in today's climate with website creation, hosting, SEO and social media management, telephone greetings and VoIP services, and online video production.